So as we've talked about being at the point of care for clinical practice, I do think that it's so important to really focus on communicating in terms of nursing process. And communicating is part of implementation. When you look at all of nursing processes, how well do you communicate? Because we hand residents off all the time. We accept residents. We hand them off to other people in our care. And that's all part of implementation. So as I mentioned getting started, that I did want to spend some time on this because at the point of care, the elements of a fall prevention program does include communication. And that's communication about the care plan. How is it working? We don't oftentimes know how well the care plan is actually working. So this includes your handoffs, how you do your rounds to make sure you're keeping eyes on those residents who really need to have increased surveillance, your whiteboard communication, what's communicating in team meetings. So I love focusing on communication because communication is all about your implementation process for all of your shifts. And handoff communication is such an integral part of care coordination and delivery of safe patient care. So your handoff efforts are so important, and they have multiple functions. And when you look at the functions that I have listed here, it's about transferring responsibility and accountability for our residents' care to the next person.